There are four systems of healthcare in the world, basically four models. I alluded to Europe before. So Asia, which is Taiwan and Japan, and then the European countries, have a single payer system. It's not really single payer in a way, but it actually is. But it actually isn't. Okay? It doesn't really matter. The way it came about was Otto von Bismarck, who was an autocrat, decided that he was going to throw something out to the working class. And they make ranking funds, sick funds. And so the way that it works is that because of the laws in these countries, everyone has health insurance. You get it through your business, through taxes. That's analogous also to like getting Medicare through deductions from your paycheck and that sort of thing. So that's the way that it's single payer. If someone is not working, the person still has health care. Now, in those countries, every doctor is a private doctor. Okay, so it's not, the person is not not an employee like in England or Canada. It's a private doctor. So those of you who might think that maybe that's good or bad, whatever, but that's what we have in those countries. Every insurance company that actually gives, that administers that health insurance is actually a private company. But they're a private company that has to administer a beautiful, complete insurance policy. And usually there's one for all. Let's imagine the Senate policy, all of us having that. Now, with that policy, there's one set of codes, one set of billing fees, one set of administrative, processes, and because of that, then their cost, administrative cost, is down to about 6% or lower, much like actually Medicare sometimes or Access here. In the United States, we're paying 31%. So if the people in the Senate and the Congress a few years ago said, listen, what we really need is to do like Richard Nixon actually asked. He asked that Medicare be for all, okay? The administrative cost would have gone down from 31% to 6%. Wow. Everyone could be covered. And single payer is very, very, very possible. But again, how do we get it when we have people saying it's socialism, when the Koch brothers are, they were behind the last shutdown of the government and, putting together the Obamacare and defunding it along with the budget. That was one of the Koch brothers was. So there are organizations that work for single payer. There's an organization of physicians, called the Physicians for National Health Service. But the issue is, how do we do it? Now, I have an idea. I somehow think that things are going to get so bad because the Affordable Care Act, because of what it tried to do, and do it within such a torturous environment. Okay, it's crazy. It's Rube Goldberg stuff. Okay, still, it's going to work. It's going to do some good things. But I think that people at some point are going to throw up their arms and say, look, we can't do this anymore, because insurance premiums continue to go up. People who have insurance can't even use it because it's so expensive. So single payer, okay, how do we tell the American people that we are the only advanced country that doesn't have single payer universal health care? During the Occupy movement, I was trying to tell people that we're the only country where people go bankrupt because of health problems. We're the only country where people people are foreclosed on because of their health care issues. How do we get this out?
And it's just, it isn't a big, huge piece of that $31 million or whatever the cost is, the people behind the computers with the coding, and they added like 1 million new codes like 2 years ago. Isn't that included in healthcare costs? That's it, right?
Yeah.
To me.
Yeah.
And then they lose their jobs, but it's not even healthcare.
Yeah.
It's just crap, so that's just a part of what you're just saying.
Okay, this is not a Bank of America card. This is a healthcare card. I'm French. Okay? So what happens in France? I go into the doctor's office. There's a receptionist. I go into the doctor. The doctor takes the card, puts it into her computer. All of my health history is down there. He sees me, she sees me. They don't have to have coders. They don't have to have all these back office people. Okay? And he just does, or she does, what they did, and it's automatically billed. Okay? And I do pay a little copay, and then I get, before the month is out, I get a lot of that back. And I'm talking about a minuscule copay. Duke Medical Center, Duke University Medical Center, they have 700 beds. You know how many full-time coders they have? 700. Oh, come on. You know, it is not patriotic to take the treasury from the people of the United States and make a few people very rich with it. It's not patriotic to be stupid. It's not patriotic to be wasteful. You know, if we're going to be in a capitalist period for another 100 years or so, if Marx was wrong, if we're not ready for socialism, if we're never going to see a time when communism comes, which means communism means no state. You don't need the state anymore because everything's hunky-dory. We all have become very evolved human beings. We love each other. You know, society is peaceful because there's justice. Okay, let's say we're going to stay with this economic system that we have now. And I think that's pretty much, you think that's true? It would probably be with capitalism. Well, you know, there's a difference between laissez-faire capitalism. There's a difference between what we had in the Gilded Age and between, like, you know, somewhat decent capitalism where people at least were able to fight and have their rights. In the 1950s, 1 out of 3 people belonged to a union. Okay? I never thought I'd be sitting here in the 21st century rhapsodizing about the 1950s. Now, do not forget, make no mistake, as our president was saying, make no mistake, that there was a large population of people, blacks, migrant laborers, Asians, Hispanics, who were not part of that economy in the 1950s. Okay, let's never forget that. And it's off there, from their sweat, that the profit was also made and enabled the rest of the people to maybe have a better standard of living. So please never forget that. But because my father was a labor organizer, because people fought, Cesar Chavez in this part of the world fought, we had unions. And we don't have that now. Yes.
I'd like to fast forward to just the last couple of weeks on this issue. And that is, it's become abundantly clear that the message from the right, the titular right, is saying the ACA is already a failure and that it cannot work, and then there's silence. They have no answer for it. They only have the nihilistic point. My counter on this is, where is the left saying, yes, we agree there are problems. One of the problems is there is no public option. There is no single payer. And if the voices that occasionally are heard in the media would actually be saying that, there was an answer. We made a mistake. We didn't take that vote in 09 or 10 on the matter of it. The Democrats who were in charge in the Senate, the White House, and Congress agreed not to even vote on it. So they were the cowards, unfortunately, at that moment, at that crisis moment. America doesn't even know what their representatives think about it, other than we assume they were against it because they didn't want to have to be forced into it. Either I get the money from my banks who underwrite, or I go with the people. Sorry.
And Obama wanted a single payer, right?
Sure.
No, he didn't. No, he didn't. No, he didn't. He never expressed it. His point was, let me make this point. He said during the campaign that if we were starting from zero, if we had no health care program at all, I would of course want a single payer. Well, that's setting up a straw, and something that can't possibly happen. So he was against it. He was against it for totally craven reasons, and the proof is in what happened, because he never did speak up when he could have. So my point is, the Republicans of all people have given us an opportunity, but the left is not prepared to take that and say, we've got an answer for you Republicans. It's called single payer. Here it is.
You have to have the words there. And this comes up all the time. I see about 16 human beings a day. Not all of them are from the university. A lot, I have liberals, I have progressives, I have people who are, very, very conservative. And I have to talk to them in a loving way, in a way where I do not become angry. Because I'm seeing people for free. Okay, when people lose their insurance, they're my patients, I keep them because I feel that there's like this sacred responsibility to your fellow human being, because nowhere else is that happening in society. So let's go through the words. One phrase is single payer. Well, single payer, then the person will then talk to you about capitalism and socialism, as one person did. So how else do we, how do we argue this? Do we do it on efficiency, on waste? Do we do it on justice? That's why I started with Martin Buber. I had a patient say, so Dr. Puca, and the wife's trying to shut him up, right? You're always a dummy here. The wife saying, no, don't say that to him. And she said, what do you think about Obamacare? And they knew what I thought about it. And I said, listen, anything that brings health care to more people is great, because we don't have health care in our country. And then he started calling it socialism.
So it's choice. You could free market choice. That's how I remember reading about it when they first brought it all up. It was like, well, single payers, you get to go to whoever you want. So that was attractive to me. So that would be like a Republican way of looking at it. Oh, choice.
So, excuse me, I'm sorry.
So if we think in terms of a public option, as Dick pointed out, is Medicare bureaucratically set up for us to switch to it? Is Medicare set up to be the public option right now? Can we do it under the form that it has right now? Could it be that simple of just using Medicare as the public option?
Yeah, it could. The insurance companies will still administer it, but there will be one set of administrative costs. In Europe, the way that the insurance companies make money is they don't gouge for profit like in the United States, but they just get an administrative fee. Now, in Germany, that's why I was cagey about is it single payer in Europe, because it turns out to be single payer, but it's not really what it is. The people pay for it. But if the insurance company is doing a good job, then more people go to it than the other one. So just on the basis of volume, that's how they make their profit. And I think that's much better than having the government do it. Just because, I believe in government. I believe in self-governing. But I also know that sometimes things get very, very inefficient. But it can. And Richard Nixon, come on. He felt that we could do that. Okay, so if Richard Nixon had a more just and global view than Barack Obama did, I mean, what has happened to this country in these intervening several decades?
So if we go to the site, could you mention it one more time, Dr. Puca, the physicians,
For a national health program.
and are they, is that part of what they're pushing? If I go to that website, are they going to be talking about Medicare as a public option?
Yeah, they're talking about single payer,
And you-
which would be through like something like Medicare.
Something
Yeah.
like that.
Yeah,
Okay.
Or, and since we have Medicare.
Well, thank
Okay,
you very
thank
much.
you.
Doc.